And welcome back to American Agenda, everyone. I'm Allison Maloney.
And I'm Bob Sellers. A lot more coming up in today's program. But first, let's check in with Emma Reckenberg and a look at some of today's headlines. Emma.
That's right, Bob and Allison. The Las Vegas police officer who was reportedly shot in the head on the Las Vegas Strip Monday night is in grave condition and still fighting for his life. That's according to reports from last night. 29-year-old officer Shay Michelonis of the Las Vegas Metropolitan Police Department is on life support after being shot in the head Monday night when attempting to disperse a group of protesters. A 20-year-old suspect has been taken into custody and charged with attempted murder. And we are learning new details about charges for the officers involved in the death of George Floyd. Charges against the ex-Minneapolis cop Derek Chauvin have now been upgraded to second-degree murder. The other 3 officers at the scene will also be facing charges. And Facebook's chief executive, Mark Zuckerberg, told staff at a company-wide meeting yesterday that he will not change his mind about a decision to leave up posts shared by President Trump last week, those of which many Facebook workers believed violated the company's policies against violent rhetoric. The dismay referenced Trump's post that threatened looters being shot, but Zuckerberg told workers that he could not justify the post as clearly inciting violence. He added that Facebook is exploring whether the company should change their policy or come up with other ways to flag posts. Those are just some stories we're following for you right now. For breaking news, you can go to newsmax.com. Bob, Allison?
All right. Thanks so much, Emma. Now to the coronavirus crisis. Today, Dr. Fauci announced that the U.S. should have 100 million doses of a coronavirus vaccine by the end of the year. The news comes as current treatment options, however, are seeing some unusual side effects. In Wuhan, this doctor's skin darkened during his COVID treatment. So joining us now to discuss what's happening is emergency room physician and former U.S. Navy Commander Dr. Richard McCormick and Dr. Jonathan Baugh, Chief Medical Officer, Remote Health Solutions. Dr. Baugh, I want to start with you. This is not the first time we've seen some unusual conditions from treatment. What do you make of this?
Yeah, you're exactly right. And one of the things that we know as physicians and providers taking care of patients with the COVID-19, the SARS-CoV-2 virus, is the fact that there has been some abnormal or unusual side effects or effects when we see these patients that are positive for COVID-19. Some of them have been blood clots or loss of taste or smell. And some of those that we know the reasons why, and others we don't know yet. For instance, when we talk about blood clots, that's a more common issue that we're seeing with COVID-19 patients. It's actually quite common in diagnosed patients, and one of the reasons for that is the fact that we know that it reacts with or interacts with the epithelial lining, the lining of the blood vessels in the human body, and that's one of the causations that we already know is a cause for blood clots in the body, and so there are reasons for all of these additional sort of abnormal side effects. We're just seeing a lot more of them right now, maybe with the COVID-19 than other viruses that we've seen recently.
Dr. McCormick, do we have a good feel now for the average COVID patient, if you will, even those that have serious symptoms and recover? Do they have impairments that stay with them? Have we gotten a feel on that?
We don't. There's going to be so much evidence that's going to come out in the next couple of years. I would say, like most disease processes, you're going to have the outliers where people have strange reactions, and that's usually caused to an overreaction of your body. In other words, some people just their immune system goes crazy when they get invaded by some sort of organism, and so they can have all kinds of autoimmune responses that really affect them long term. Most of the time, the disease, once it's taken under control, doesn't affect you any longer, but it's your body's autoimmune response that really affects you. And to go with the clotting disorder problem, I think one of the other things that adds to that is the fact that these patients are stationary, and anytime you're stationary or intubated and you're not moving around, it just adds to the clotting problem.
Dr. Baugh, I know Dr. Fauci said that we'll have a vaccine at some point, but normally vaccines, they're tested and tested and tested. I mean, how safe do you think this vaccine will be? Because me as a mom thinking that I have to give my child a vaccine that really we don't know much about, is it safe?
Yeah, that is a really great question. The way that we're working through this is definitely different than we normally do. We talk about a normal vaccine timeline, and we talk about that from beginning to end being about 5 to 10 years normally. And then we've compressed that time down to about 18 months. And then with the Operation Warp Speed, then we're talking about 9 to 12 months in this process. And we are saying that we're hoping to have 100 million doses by the end of 2020 and 200 million doses by 2021, early part of the next year. The way that we're doing that is we're moving through phase 1, phase 2, and phase 3 of these trials all at the same time. And so phase 1 really just tests, is it safe? And then we get a little bit of an insight, is it effective? Maybe. And what we did see with phase 1 with this Moderna vaccine was the fact that it was effective. It was very safe, and it was effective in the fact that it brought forth some antibodies. Your body created antibodies, and they're about the same level as if you would have recovered from the disease independently. Now, what we don't know is, are those antibody levels high enough to have an effect in keeping you safe from getting the disease COVID-19?
Yeah.
And then phase 2 moves us forward. And so what they're doing is they're doing phase 2 right now. We've already started phase 2 with the Moderna vaccine, and then in July we're going to start phase 3. Now, phase 2 is going to last a full year, and that is going to be measuring the side effects and the effectiveness of that vaccine at a couple of different levels of dosage. And so we're going to have a year worth of study there. We're hoping that we will be gaining enough information through this process before the end of the year. And what we're going to be doing is we're going to be investing some money and some time into creating a vaccine. We're going to create doses before these studies are done so that they're ready to go if indeed the vaccine proves effective.
Okay.
We're still going to be guessing. We're still going to be gathering a lot of information, and we're going to be moving forward. But we should have a lot of data before the end of the year, and we should have those vaccine doses done before the end of the year.
Okay, Dr. Baugh, thank you very much. Dr. McCormick, sorry we ran out of time here. Thank you for being with us, gentlemen, and we have more on the spreading violence in America after this.